My name is Somnuk Phonesouk. I'm a GP IMC with a specific interest in injury management and return to work, especially in the aviation and manual handling field. So at the very basic core, I'm a doctor and a GP, but I've been working in helping injured workers for about 20 years now, both in the military and civilian world. I help people get better and not only return to work, but do so whilst staying at work. What I enjoy most is helping people, especially when they get better, and particularly when they say thank you. I became very interested in injury management because I like sports, and injury management is very much like sports injuries. Mostly they're motivated, young and old people who would like to get better and return to what they were doing before they got hurt. For the last 10 to 12 years, I've been working at the international airport, so primarily in the aviation field. However, I still get a lot of patients from outside the airport for more walks of life. I play the role of doctor. I also play the role of communicator with the insurer when people get injured at work. And I play the role of negotiator when things don't go the way that people like it to go, and then it's all about negotiating and communicating to achieve the best outcomes for everyone involved. Primarily the aviation and manual handling field, a lot of these people are like athletes. They're highly trained, they're motivated, they know their craft. When they get injured, they want to be treated like a specialist or an athlete, someone who knows their body, is motivated and interested and educated in getting better and returning to what they really enjoyed doing prior to getting injured. Firstly, I believe that communication with all stakeholders is vastly important. It's probably the most important factor. I like to communicate directly with not only the injured worker, but the claims people, the insurers, the return to work, and the employers. I think all stakeholders have a role to play, and they need to have their say and feel valid in the process. I believe that after communication, negotiation with all stakeholders, and thirdly, I think compassion to all parties, particularly the injured party, is most important, and I pride myself in my compassion. The message or impression that I want the person to take away from their assessment is that when I see an injured person, I want them to feel valid, I want them to feel heard, I want them to feel that I'm compassionate to their cause, but also for them to understand the process and the communication, their rights as well as their responsibility. Because the return to work process is, as the term suggests, a process. And that needs to be communicated to everyone, particularly the injured worker who may not have a full understanding of how the whole scheme works. I am hoping to combine the science of medicine with the art of medicine, with an understanding of processes and medico-legal aspects, whilst combining a compassionate outlook, maintaining the highest standards of integrity and communication and negotiation with all stakeholders.